Hello everyone, and welcome back. Today, we're going to walk through the professional and safe way to administer an injection, ensuring maximum patient safety and comfort. Before we begin, the most important step is preparation. Always start by thoroughly checking all your supplies. Make sure you have the correct medication, a sterile syringe, alcohol swabs, clean gauze, and all necessary equipment. Carefully check the expiration dates and ensure everything is properly sealed and sterile. Remember, patient safety begins before the injection even starts. Next comes hygiene. Wash your hands properly using soap and water. After that, put on a fresh pair of medical grade gloves. Gloves are essential in preventing cross-contamination and maintaining a sterile environment. Make sure they fit properly so you can maintain full control and precision while working. Now carefully inspect the medication, whether it is in a vial or ampule. Always check the solution before use. It should be clear and free from any particles or discoloration. Confirm the correct dosage according to the prescription. If you are using a vial, always disinfect the rubber stopper with an alcohol swab before drawing the medication. This is a critical step to maintain sterility. After that, prepare your syringe. Ensure the needle is properly attached and secure. Draw the medication carefully and remove any air bubbles, if present, for an intramuscular injection. The correct technique is to insert the needle at a 90-degree angle. This allows the medication to reach deep muscle tissue effectively and safely. Position your hands steadily and maintain full control of the syringe. Gently stretch the skin at the injection site to reduce discomfort. Insert the needle smoothly and confidently at a 90-degree angle. Slowly depress the plunger to administer the medication. Once the injection is complete, withdraw the needle quickly and safely. Immediately apply a clean cotton ball or sterile gauze to the site. Apply gentle pressure, but do not rub the area, as this may cause irritation. Finally, dispose of the used syringe and needle immediately into a proper sharps container. Never reuse or leave medical waste unattended. And that is how you safely and professionally administer an intramuscular injection. If you found this guide helpful, make sure to like, share, and subscribe for more medical education content. Stay safe, stay informed, and thank you for watching.